We're going to begin with our big story tonight at 10, a bloody good idea. Every fire department in Milwaukee County will soon have a new resource that could mean the difference between life and death for trauma patients.
And that resource comes from you. Our Sam Kramer is live in Wauwatosa tonight to explain how a high-tech cooler and a lot of coordination brought all this together. Hey, Sam.
Yeah, hi there, Ted and Mary. This isn't your typical igloo, or in this case, Coleman cooler by any stretch of the imagination. Here in Tosa, the fire department's ambulance now has one that has Bluetooth, Wi-Fi, and cellular capabilities. Why? Because they are tracking and carrying something new: blood.
Climb in the back of this Wauwatosa Fire Department ambulance, and you'd never notice its newest feature.
We're the first fire-based EMS system in the state of Wisconsin to be doing this, so we're pretty excited.
A cooler that stores 2 units of type O positive blood just above freezing temperatures.
We're carrying the blood because you never know how long it will take us to get that patient with that injury to the hospital.
It's part of a pilot project for trauma patients through the Milwaukee County Office of Emergency Management. Dr. Ben Weston is the chief medical director.
When folks are having traumatic hemorrhagic shock, so what that means is they're losing a lot of blood, and they're in a critical condition, what they really need is blood.
The fluids help stabilize a patient's pressure so that blood can flow to the organs. Soon, when any of the county's 14 fire departments respond to a trauma call, these trained paramedics and EMTs can now act as an extension of trauma-trained hospitals by providing those patients a whole blood transfusion in place of a classic IV. Studies show that can increase the survival rate by more than 80%.
We're going to bring what patients need to the field, and ultimately this program will save lives.
And it's not just here. UW Health is now using whole blood on its MedFlight helicopter in Dane County, where Dr. Ryan Newberry says the benefits are already showing.
The reality is there's a lot of distance to move these patients, and time matters. And so the more that we can push out the care that you would get at a trauma center to where you are, and we can start the care where you are, it allows us to start treating you there.
So here in Tosa Fire tells me they plan to store that blood, keep that blood. Whoa, our light just went out. For about 7 to 9 days. If it is not used, they will then bring it back here to the hospital where they will swap it out for new blood. But don't worry, that old blood doesn't go to waste. It will, and then go to the top of the list inside the hospital where it will be used right away. Of course, both doctors say this relies on blood donations. If you are type O blood, they want you to donate. We're live tonight in Wauwatosa. Sam Kramer, FOX 6 News.
Maybe a little dark, Sam, but we heard your message loud and clear. There you are. All right. Thank you, my friend.